One of the biggest misconceptions about yoga therapy is that people think it's trying to replace physical therapy, and it's not. And honestly, any mature yoga therapist wouldn't think that way. Physical therapy is incredibly valuable. In many situations, it should absolutely be the first stop for someone dealing with pain, injury, or recovery after surgery. But yoga therapy brings something different to the table. And understanding the difference between yoga therapy and physical therapy is actually one of the signs of a well-trained yoga therapist. Before we dive in, if we haven't met, my name is Brant Pasalacqua, and I'm the co-director of the Breathing Deeply Yoga Therapy School. Over the years, I've worked with hundreds of yoga therapy students and clients, dealing with everything from chronic pain and anxiety to complex mind-body conditions. And one thing I've seen over and over again is that real healing often requires understanding of both the physical side of a condition and the deepened patterns affecting the whole person. That's part of why conversations like yoga therapy versus physical therapy are so important. So in this video, I want to break down what physical therapy does exceptionally well and what yoga therapy does differently, where they overlap, when someone should see one versus the other, and why some of the best outcomes happen when both approaches work together. First, yoga therapy and physical therapy actually share several important similarities. Both are trying to help people heal, both involve assessment, both involve movement, both involve individualized treatment planning, and both require practitioners to understand anatomy, pain, movement patterns, and how the body adapts over time. A good yoga therapist is not just teaching random poses, and a good physical therapist is not just handing out exercises. Both professions are trying to understand what is actually happening in this person's system. The biggest difference is this. Physical therapy primarily focuses on the body itself, and yoga therapy works with the whole person. Now, that doesn't mean that yoga therapists ignore the body. Obviously, we work with movement, posture, breath, tension patterns, and pain. But yoga therapy also asks questions like, how is stress affecting this condition? How is breathing affecting pain? Is trauma involved? Is anxiety amplifying symptoms? Is this person exhausted, dysregulated, or disconnected from their body? Why does this issue keep becoming chronic? That's where yoga therapy becomes different, because sometimes pain is not just structural. Sometimes there's a nervous system component. Sometimes there's a fear component. Sometimes there's chronic stress. Sometimes the body is healed, but the full person never really recovered. And that's where yoga therapy can become incredibly valuable. I also want to be really clear about this. Physical therapists have extensive medical and clinical training. They're trained in pathology, orthopedic assessment, rehabilitation, movement dysfunction, post-surgical recovery, and much more. If someone has an acute injury, post-surgical rehab, major mobility dysfunctions, neurological impairment, or significant structural pain, a physical therapist might absolutely be the first step. And honestly, referral intelligence is one of the marks of a good yoga therapist. Yoga therapists should know this person needs imaging, this person needs an orthopedic evaluation, this person needs medical care, this person needs a PT. That's professionalism, not trying to treat everything yourself. Where yoga therapy often shines is when issues become chronic, complicated, or multidimensional. For example, maybe someone finished PT, but they still don't feel well. Maybe movement still creates anxiety. Maybe they become afraid of their body. Maybe stress keeps amplifying symptoms. Maybe they've developed chronic tension patterns. Maybe their breathing is shallow and reactive throughout the entire day. Or maybe trauma is part of the picture. This is where yoga therapy can become incredibly powerful because we have additional tools that aren't just movement, like breath work, meditation, pacing, nervous system regulation, interoceptive awareness, behavioral patterns, lifestyle patterns, energetic and psychological dimensions of healing. These are all things we work with. And importantly, yoga therapy can often spend more time with clients than insurance-based systems allow. And that deeper relationship can matter Because sometimes people don't just need exercises, they need to learn how to safely reconnect to themselves. So let's say someone gets into a car accident and develops whiplash. Physical therapists might be exactly who they need initially. We'll do mobility, strengthening, rehabilitation, assessment. But now imagine that same person develops anxiety while driving, or hypervigilance, or panic when they feel neck tension, or they stop trusting their ability to move. Now we're no longer dealing with only a musculoskeletal issue. Now we're dealing with a whole person healing process. And that's where combining yoga therapy and physical therapy can be incredibly effective. Not competing, but more collaborating. One thing I really try to teach our students at Breathing Deeply Yoga Therapy School is clinical maturity. Clinical maturity means understanding scope, knowing when to refer out, understanding complexity, respecting other professions, and not oversimplifying healing. Real healing work is nuanced. And honestly, clients tend to trust practitioners more when they can say, here's where I could help, here's where another professional may help, and here's how we could work together. That's very different from the mindset of yoga fixes everything. It doesn't, but it can become an incredibly powerful part of an integrated healing process. Interestingly, many people who come into yoga therapy are already healthcare professionals. I've had PTs, PTAs, mental health professionals, nurses, body workers, and of course, yoga teachers. They all come through our training because they wanted a more holistic framework, not to necessarily abandon their profession, what they're already doing, but to deepen it and to better understand breath and trauma-informed work and how meditation can help conditions, mind-body relationships, and also how to really work with an individualized therapeutic process. And honestly, I think healthcare is moving more and more in this direction. People want integrated care. So if you take one thing from this video, let it be this. Yoga therapy and physical therapy are not enemies. They're different systems with different strengths, and some of the best practitioners understand both the power and the limitations of their own modality. If you're interested in becoming a yoga therapist or learning how to retrain practitioners to think clinically, holistically, and collaboratively, you can learn more about our professional training program at Breathing Deeply Yoga Therapy School using the links below. And if you have any questions about yoga therapy versus physical therapy, leave them in the comments. I'd love to hear your thoughts. So I look forward to hearing from you, and thank you so much for listening to this video.